Welcome to this in-depth documentary on one of the most misunderstood topics in men's health. Today we're going to talk honestly and scientifically about testosterone, the prostate gland, and sexual health in older men. This is information that every man over 40 needs to hear. We'll separate fact from fiction, bust decades-old myths, and give you real evidence-based answers. Let's start from the beginning. Testosterone is the primary male sex hormone produced mainly in the testes. It plays a critical role in developing male reproductive tissues, maintaining muscle mass, bone density, red blood cell production, and sexual function. Testosterone also influences mood, energy levels, and cognitive function. In short, it is one of the most important hormones in the male body. Now here's what most men don't realize. Testosterone levels naturally begin to decline after the age of 30. After 30, men lose approximately 1 to 2% of their total testosterone per year. By the time a man reaches his 50s or 60s, his testosterone levels may be significantly lower than they were in his 20s. This gradual decline is completely natural and is sometimes referred to as andropause or male menopause. But the symptoms of low testosterone are very real and can seriously affect quality of life. The most common symptoms of low testosterone include fatigue and decreased energy, reduced libido or sex drive, erectile dysfunction, loss of muscle mass and increased body fat, mood changes including depression and irritability, difficulty concentrating, and decreased bone density. If you're experiencing several of these symptoms, it may be worth speaking with your doctor about getting your testosterone levels tested. A simple blood test can measure your total testosterone and free testosterone levels. Normal testosterone levels in adult men typically range from 300 to 1,000 nanograms per deciliter. Levels below 300 are generally considered low and may warrant treatment. Testosterone replacement therapy, also known as TRT, is one option for men with clinically low testosterone. TRT can be administered through injections, patches, gels applied to the skin, or pellets implanted under the skin. While TRT can improve energy, libido, mood, and muscle mass, it is not without risks. Potential side effects include acne, sleep apnea, reduced sperm production, and an increase in red blood cell count. Importantly, TRT should always be supervised by a qualified medical professional. If you prefer to support your testosterone levels naturally, there are several evidence-based strategies. Regular resistance exercise, such as weightlifting, has been shown to boost testosterone levels. Maintaining a healthy body weight is crucial, as obesity is strongly linked to lower testosterone. Adequate sleep is essential. Most testosterone is produced during deep sleep cycles. A diet rich in zinc, vitamin D, and healthy fat supports optimal hormone production. Managing chronic stress is also important, as the stress hormone cortisol directly suppresses testosterone. Now let's move on to the prostate gland. The prostate is a small walnut-sized gland located just below the bladder surrounding the urethra. Its primary function is to produce seminal fluid, which nourishes and transports sperm. The prostate gland is vital to male reproductive health. However, as men age, the prostate often becomes a source of significant health concerns. The two most common prostate conditions in older men are benign prostatic hyperplasia, commonly called BPH, and prostate cancer. BPH is a non-cancerous enlargement of the prostate gland. It affects more than 50% of men in their 60s and up to 90% of men in their 80s. As the prostate enlarges, it can squeeze the urethra and cause urinary symptoms. These symptoms include frequent urination, especially at night, difficulty starting urination, a weak or interrupted urine stream, and the feeling of not fully emptying the bladder. While BPH is not dangerous on its own, it can significantly affect quality of life. Treatment options range from lifestyle changes and medications to minimally invasive procedures and surgery. Prostate cancer is the most common cancer in men after skin cancer. In the United States alone, approximately 1 in 8 men will be diagnosed with prostate cancer during their lifetime. Risk factors include age, family history, race, and diet. African American men have a significantly higher risk of developing prostate cancer compared to other groups. The good news is that prostate cancer, when caught early, is highly treatable. Early detection is the key to successful treatment. Screening for prostate cancer typically involves a PSA test, which measures prostate-specific antigen levels in the blood. An elevated PSA level does not necessarily mean you have prostate cancer, but it is a signal that further investigation may be needed. A digital rectal exam, or DRE, is another screening tool where a doctor manually checks the prostate for abnormalities. Most medical guidelines recommend that men discuss prostate cancer screening with their doctor starting at age 50. Men at higher risk, such as African Americans or those with a family history, should begin screening conversations at age 40 to 45. Now let's address one of the most persistent myths in men's health. Does testosterone cause prostate cancer? For decades, there was a belief that higher testosterone levels fueled prostate cancer growth. This belief stemmed from early research in the 1940s showing that testosterone deprivation could slow prostate cancer. However, more recent research has challenged this old paradigm. Studies now suggest that the relationship between testosterone and prostate cancer is far more complex than once thought. The current scientific consensus is that normal testosterone levels do not cause prostate cancer. In fact, very low testosterone may be associated with more aggressive forms of prostate cancer. The saturation model, proposed by Dr. Abraham Morgentaler, suggests that prostate tissue becomes saturated with testosterone at relatively low levels, meaning additional testosterone has little effect on prostate cancer growth. While TRT remains controversial in men with a history of prostate cancer, many experts now believe it can be used carefully in selected patients after appropriate treatment. Always consult a specialist if you have concerns about testosterone and prostate health. Diet plays a significant role in prostate health. Foods rich in lycopene, such as tomatoes, have been associated with a reduced risk of prostate cancer. Green tea contains compounds called catechins that may have protective effects on the prostate. A diet high in red meat and saturated fats has been linked to increased prostate cancer risk. Incorporating more fish, cruciferous vegetables, and plant-based proteins into your diet may benefit prostate health. Limiting alcohol consumption and maintaining a healthy weight are also important factors. Regular physical activity, particularly aerobic exercise, has been shown to reduce the risk of prostate cancer and improve outcomes in those already diagnosed. Now let's talk about masturbation and sexual health in older men. This is a topic that carries significant social stigma and is rarely discussed openly, even in medical settings. But the science is clear. Sexual health is an important component of overall health and well-being at every age. Masturbation is a normal, healthy sexual activity practiced by people of all ages. For older men, regular sexual activity, including masturbation, can have several health benefits. These benefits include stress reduction, improved sleep, pain relief through endorphin release, and maintenance of sexual function. Now, one question that many men have is, does the frequency of masturbation or ejaculation affect testosterone levels? This is where things get interesting. Some studies have shown short-term fluctuations in testosterone levels following ejaculation. One study found that testosterone levels were slightly elevated on the 7th day of abstinence. However, these fluctuations are temporary and do not reflect a long-term change in baseline testosterone levels. The overall scientific consensus is that masturbation and ejaculation frequency do not significantly alter long-term testosterone levels. So if you've heard that abstaining from ejaculation will dramatically boost your testosterone, the science does not support that claim. Now let's look at the relationship between ejaculation frequency and prostate health. This is where the research becomes particularly compelling. A landmark study published in JAMA involving almost 30,000 men found that men who ejaculated 21 or more times per month had a 33% lower risk of prostate cancer compared to men who ejaculated 4 to 7 times per month. Another study from Australia found similar results, associating higher ejaculation frequency with reduced prostate cancer risk. Researchers believe that frequent ejaculation may help flush out potential carcinogens that can accumulate in the prostate gland. While correlation does not prove causation, these findings suggest that regular sexual activity, including masturbation, may be genuinely protective for prostate health. This is a remarkable finding that deserves to be more widely known. Now let's take some time to bust the most common myths about testosterone, the prostate, and masturbation in older men. Myth number 1, testosterone makes men aggressive and dangerous. This is one of the most pervasive myths in popular culture. While testosterone does influence competitive behavior, the idea that it causes uncontrollable aggression is not supported by the scientific literature. Most studies show that the relationship between testosterone and aggression is weak and highly context-dependent. Myth number 2, Masturbation causes physical health problems. This myth has existed for centuries, perpetuated by religious and cultural beliefs. Scientific research consistently shows that masturbation does not cause blindness, infertility, erectile dysfunction, or any other physical health problem. In fact, for older men, regular masturbation can help maintain sexual function and penile health by promoting blood flow. Myth number 3. Older men don't need to worry about sexual health. This could not be more wrong. Sexual health is important at every stage of life. Men in their 60s, 70s, and even 80s can and do maintain active, fulfilling sex lives. Addressing sexual health concerns in older men is a legitimate and important medical priority. Myth number 4. A high PSA test result means you definitely have prostate cancer. An elevated PSA can be caused by many conditions, including BPH, prostatitis, and even vigorous physical activity. A high PSA warrants further investigation, but it is not a definitive cancer diagnosis. Myth number 5. Testosterone replacement therapy always causes prostate cancer. As we discussed earlier, the scientific evidence does not support this claim. TRT does not appear to cause prostate cancer in men with normal prostate health. However, TRT is typically avoided in men with active or untreated prostate cancer. Let's bring everything together with the key takeaways from this video. Testosterone naturally declines with age, and low testosterone can significantly impact quality of life. Treatment options exist, both medical and natural, and should be discussed with your doctor. The prostate gland is central to male reproductive health and requires regular monitoring as you age. Prostate cancer is common but highly treatable when caught early, so regular screening is essential. Testosterone does not cause prostate cancer, and TRT may be safe for carefully selected men. Diet, exercise, and lifestyle choices have a profound impact on both testosterone levels and prostate health. Masturbation and regular ejaculation are normal, healthy behaviors that may even offer protective benefits for prostate health. Sexual health is an important and often overlooked component of overall health and well-being in older men. Don't let embarrassment or stigma prevent you from discussing these topics with your healthcare provider. Your health is worth the conversation. Thank you for watching this video. If you found this information helpful, please consider sharing it with someone who might benefit. Remember, knowledge is the first step toward better health. Take care of yourself, stay informed, and don't be afraid to ask the hard questions. Until next time, be well.